Well, for a closer look at the Ontario shutdown, we've reached out to Dr. Amit Arya. Now, he is a palliative care physician in the GTA. He's co-founder of Doctors for Justice in Long-Term Care, and he joins us from Mississauga, Ontario. Doctor, thanks so much for joining us early on a weekend.
Yeah, good morning, John.
What was your reaction when you heard the announcement about the shutdown?
Well, to be honest, I think it's contrary to science and logic, and it's very misguided. It's really odd to me that we're allowing big box retail to stay open. We have schools open, places of worship open, but yet outdoor situations like sitting on a patio where you should have 100% ventilation are closed. There were no new protections announced for schools like vaccinating teachers or improving ventilation or class sizes. And most importantly, at this point, the pandemic is bearing its brunt on essential workers, the people we've called heroes. These are the people that we're seeing suffering and dying and coming into our hospitals and overwhelming our ICUs. So there was no announcement about paid sick days. And our vaccine rollout is also a failure. We have over 500,000 doses sitting in freezers at this point in time. And actually the highest risk neighborhoods are receiving the lowest amount of vaccine.
So under the circumstances you describe, along with the shutdown that you argue is inadequate and arguably misdirected, what do you fear could come out of that?
Well, I'm very worried, firstly, because now the government has enacted these half measures, and now they're going to sit back and they're going to look at the data and they're going to see, how does this play out? And they're going to hope that it's going to help. But this is really a whole new pandemic with these variants of concern driving the majority of cases. A reminder to everyone watching. Variants of concern, the data here in Ontario shows that your risk of ending up in the ICU is over 100% higher. Your risk of death is over 40% higher. And this is not last March. This is not March 2020, because we have the vaccines. We have the vaccines, and those are really our ticket out of the pandemic to one day achieve herd immunity and hopefully enjoy the summer.
The vaccines, as you say, are available, if not necessarily getting into all the arms. Are they getting into the right arms, though? Would you like to see the vaccines redirected?
Yeah, absolutely. Right now we have 90% of the cases in Ontario coming from 10% of the postal codes. So really, this is a matter of getting the fire engines and the fire trucks where the fires are actually burning. We're all, perhaps in the same storm, but we're definitely not in the same boat. And these high-risk postal codes, places like Northwest Toronto, Peel Region, and Scarborough, are the places where essential workers live and work. So we need to get the vaccines to the workplaces, the factories, the warehouses, and we need to get them in those neighborhoods in the right arms. Right now, the province has committed to this per capita rollout of the vaccine, and that needs to immediately shift to getting it into these hotspots to hopefully bring this pandemic to an end quicker.
Those essential workers are, in many cases, of working age, younger, in other words, and we also know that the variants seem to be hitting younger people as well. Do you think there should be a ramping up or even a shifting in terms of not only the geographical locations, but also the age?
Yeah, absolutely. If you're somebody who's 55 and an accountant, and you can, you have the privilege of working from home. I could tell you I see some of my patients virtually as well. So I put myself in that category, although I've been vaccinated because I work on the COVID-19 wards. But if you're someone who doesn't see patients and you work from home on Zoom, and you're 55, versus a 30-year-old who's working on the floor of a factory and is exposed to 300 other people, takes mass transit, comes home, and lives with their parents, often in a multi-generational household in an apartment. Undoubtedly, your risk would be higher. And that's actually what our modeling data showed us weeks ago here in Ontario, where they even showed that if you're in your 50s, your risk of dying from COVID-19, if you live in those highest risk postal codes, is actually higher than an 80-year-old living in the lowest risk postal code. So age is a factor, but we can't just look at age alone. We have to look at these high-risk neighborhoods once again and shift this vaccine rollout immediately to save lives.
Looking at all those factors, what's your biggest concern right now?
Well, I'm just worried that we have a government that's politically driven and ideological driven. And once again, we're not looking at the root causes of how we ended up in this situation, in the third wave, where scientists and modelers are saying that the pandemic is completely out of control. And those root causes, once again, need to focus on, giving people paid sick days so they don't have to make this choice between, going to work sick, potentially exposing their colleagues, exposing people in transit, versus staying at home and not being able to afford the groceries rear rent. I mean, that's a very proven public health intervention that prevents people from spreading the virus. So I have no idea why they would not enact that at this time. And the other thing is that once again, I mean, our vaccine rollout needs to accelerate very, very quickly at this time to get the vaccines in the right arms. We need to achieve both speed and precision at this time to have some light at the end of the tunnel. And that's something that I'm not seeing. So I really, really hope that the government will listen at this time to avoid, further suffering and death that is preventable.
As you say, further suffering and death, you're talking about targeting underserved communities. You're talking about getting the vaccines out there. Can you just, as a final thought, talk about the larger dangers if, in your opinion, those steps aren't taken?
Well, I'm very worried for our hospital system and the ICUs. I mean, our ICUs now pretty much daily are achieving these record numbers of admissions. The government has said that they've built more ICU beds, but really from what I hear from my critical care colleagues is there's no staff actually to work, and serve in those ICU beds. There needs to be a whole team of trained health professionals, physicians, nurses, respiratory therapists, and so on, who would be, helping that patient. And the other part of this is that, well, nobody wants to end up in an ICU bed. Ending up in an ICU bed, to be honest, should be seen as a failure at this time when we have vaccines. It just doesn't make any sense to me. I mean, these ICU beds, even if someone survives, there's such high rates of disability. People's lives are just changed forever. They have post-traumatic stress disorder. It's just absolutely horrific. And, once again, I will remind everyone, these are the people, when we talk about low-income essential workers, these are the people that are keeping our grocery shelves and pharmacy shelves stocked. They're driving transit. They're driving trucks. I mean, they're the people who, are PSWs and working through home care and, serving the people that we really love and care for. So we've just called them heroes at this point in Ontario, but we haven't actually provided them with the essential protections that they need to live.
Dr. Arya, I want to thank you for your time. Really appreciate it.
Thank you, John.
Dr. Amit Arya is a palliative care physician, and he joined us from Mississauga, Ontario.